Hello, my name is Destiny Johnson. Today we're going to be discussing a gastrointestinal disease, and the disease will be hemorrhoids. Pathophysiology of hemorrhoids. Hemorrhoids are a cluster of vascular tissues, smooth muscles, and connective tissues that lie along the anal canal in three different columns, which are left bilateral, right anterior, and right posterior position. Hemorrhoids can be present universally in healthy individuals as cushions that surround the anastomosis between the superior rectal artery and middle, superior, and inferior rectal veins. The term hemorrhoid comes from the pathologic process of symptomatic hemorrhoids disease. Hemorrhoids are cured when the supporting tissues of the anal cushions deteriorate. Hemorrhoids are often caused by weakened supporting tissues that allow for downward displacement of the hemorrhoidal veins, causing them to dilate. Therefore, the blood flow through the veins of the hemorrhoids plexus is impaired. Hemorrhoids are often caused by portal hypotension, irritation, straining, increased venous or abdominal pressure. Additionally, on a histopathological examination, the changes can be seen in the anal cushions, which will include abnormal venous dilation, vascular thrombosis, and degenerative process in the collagen fibers. Clinical manifestations of hemorrhoids. Clinical manifestations of hemorrhoids include bleeding, swelling around the anus, pain or discomfort, or itching or irritation in the anal region. They are also the most common reason for bleeding with defecation. However, internal hemorrhoids most often cause painless bright red bleeding with stools. Furthermore, external hemorrhoids are reddish blue and the patient may seldomly bleed, which can cause itching and burning as well. Diagnostic studies and interprofessional care. Internal hemorrhoids are diagnosed by digital examination, endoscopy, and sigmoidoscopy. However, external hemorrhoids are easily diagnosed by visual inspection and digital examination. Furthermore, therapy is based on the cause and the patient's symptoms. Internal hemorrhoids can be removed non-surgically. Examples include laser therapy, infrared coagulation, and rubber band litigation. Furthermore, rubber band litigation is the most common technique that is used to remove internal hemorrhoids. The surgeon will insert an endoscope and identify the hemorrhoid and then litigate it with a rubber band. From there, the rubber band will constrict circulation around the hemorrhoid, which will cause the tissue to become necrotic and separate and slough off. A surgical example of removing of a hemorrhoid is called a hemorrhoidectomy. This is only done when there is marked prolapse or excessive pain or bleeding. Therefore, the surgeon will remove the hemorrhoid by clamping or excision. Once the hemorrhoid is removed, the tissue is sutured and the wound is healed by primary intervention. Other forms of treatment for hemorrhoids. Hemorrhoids can be treated in other various ways, such as eating foods that are high in fiber and increasing the patient's fluid intake to prevent constipation and reduce straining. Also, ointments such as suppositories, creams, and Duvocaine that contain anti-inflammatory agents or adjuvants may be used to shrink the mucous membranes and relieve pain. Additionally, sitting in a tub of water called a sitz bath for several times a day for at least 15 to 20 minutes will help to relieve pain. Also, the patient will want to avoid regular heavy lifting and sitting or standing for long periods of time. Also, the patient will avoid sitting on the toilet for long periods of time. Lastly, hemorrhoids can be treated with a stool softener or a fiber supplement. Now we're going to be discussing the plan of care for a patient that is diagnosed with hemorrhoids. We're going to be discussing the nursing plan of care. So the primary diagnosis would be constipation related to lack of a dietary bulk as evidenced by inability to evacuate stool and passage of a hard formed stool. Supporting data will include low fiber diet and passage of hard formed stool. 3 patient outcomes will be for this patient will include patient will increase fluid intake within 24 hours. Patient will be able to name 3 foods that are high in fiber within 24 hours, and patient will have normal bowel movement that is reestablished and maintained within 48 hours. Nursing interventions will include assessing for rectal bleeding, monitoring diet and fluid intake, and auscultating bowel sounds of presence and quality. Patient teaching will include teaching patient about measures to prevent constipation and to avoid prolonged standing or sitting. A second nursing teaching would be the nurse will want to teach the patient to seek medical care for severe symptoms of hemorrhoids, such as pain or bleeding that is excessive. The third patient teaching will be the nurse will want to teach the patient about sitz baths, and in order to reduce discomfort, sitz baths should be 15 to 20 minutes a day, twice a day. The nurse will also want to teach the patient about eating foods that are high in fiber. And if the patient has surgery, the nurse will also want to make sure the patient has surgery to remove the hemorrhoids. The nurse will want to teach the patient about laying prone or sitting or lying side position to prevent bleeding and maintaining an ice pack around surgical site. Now we're going to evaluate the patient. All goals were met. The patient was able to increase fluid intake and fiber intake within 24 hours. Within 48 hours, patient was able to have normal bowel movement that was reestablished and maintained. That is the end of the presentation. Thank you.